Good afternoon, everyone, or good morning for whatever day or time you will be viewing this video. So, um, I am Cyril Tolentino, and I will be your fourth reporter for Chapter 2, Ethics in Counseling Practice, and I will be discussing the last two ethical standards in the counseling practice. So for our topic outline, we have my topics, which are the value of evidence-based practice and the dual and multiple relationships in counseling practice. Under the value of evidence-based practice, we are going to discuss its definition, its some goals and its benefits, and some examples of interventions used in evidence-based therapy. For dual and multiple relationships in counseling practice, of course, we are to discuss its definition, the types of dual and multiple relationships, the ACA Code of Ethics, or what has the American Counseling Association Code of Ethics has to say with the multiple relationships, and um, also at the end of this discussion, we will have some additional information to maintain ethical standards in counseling. Okay, so for the first topic here, we have the value of evidence-based practice. So as defined, evidence-based practice is the responsible use of existing research and its data to guide policy and practice decisions such that outcomes for consumers are improved. It focuses on approaches proven to be effective through empirical research. With this approach, any policies and decisions are tested and proven and is backed up by various research. In counseling, it is the application of research-based treatments that is anchored by a practiced therapist to meet the individual needs, preference, and cultural expectations of those receiving them. Every treatment and therapy used by mental health care providers are evidence-based. It goes through various research and is used multiple times to assure its efficacy. So the evidence-based practice can be compared to a three-legged stool. So if you can imagine there, we have the three-legged stool. Each leg represents a different approach to the course of the treatment. First leg is the best scientific evidence, or those psychological treatment should have a strong significant support. It is important to note that not all mental health treatments are equally effective. Some therapies may best work with a special disorder than others. Scientific evidence means much more than the subjective or informal clinical impressions of a therapist. It means a thorough, rigorous, and controlled research conducted by multiple investigators. When we talk about best scientific evidence, it means that the treatment to be used for a specific disorder goes through a rigorous research, and has that's shown to be effective. So, for example, treatments used for depression, then that treatment is proven. A lot of research has suggested that treatment is really effective to cure depression. So that's one. The treatment has best scientific evidence. The second leg represents is the clinical expertise, or the degree of expertise a therapist may have in a particular problem or a particular group of people. So the whole treatment process is dependent on the therapist's own clinical expertise in figuring out on how to integrate the different piece of information provided by the client to formulate a treatment plan. Furthermore, clinical expertise includes the degree of experience that a therapist may have with a particular problem or a particular group of people. As I've mentioned earlier, when I say clinical expertise, it is, by the name itself, it is the expertise of the clinician. It's how the clinician is knowledgeable enough to find out the best treatment to be used, provided, or as based by the provided information given by the client. Now, the third leg of the stool represents the patient's preference. So that is, every patient have the right to choose the treatment to receive. psychological treatment should be collaborative in process. It should happen between the client, of course, and the practitioner, and that the therapist that respects should respect the client's own experience, needs, and values. Therefore, again, the client's own experience, the needs, its values should be respected and considered. Not only that that the practitioner will decide for the treatment to be used, the client will have also the say, kumbaga will have the final say. Because if the client is not comfortable with the treatment, then she or he can say no to that treatment and find another treatment, because we never know that client had a specific experience with that treatment with another practitioner. So it's the experience of the client should be given, it should be considered. So, EBP, or the evidence-based practice, have goals, of course, and benefits. And one of it is the increased quality of treatment. When you say increased quality of treatment, it is because EBP is trusted and proven by various research. It is expected, thus, it is expected that a therapy is more likely cost-effective. Thus, clients will only pay for and undergo treatments that shown to be effective. However, it should also stress out that caution must be taken to ensure that treatment plans should not only be cost effective but also be clinically effective as well. Therefore, there should be an emphasis on the evidence-based practice being both clinically effective and cost effective, because many treatments nowadays are not are when we say cost effective, but that doesn't signify that it is clinically effective. So the goal of the EBT is to make the treatments or the treatment plans cost effective as well as clinically effective, because treatment plans shouldn't be cost effective alone, because we will go for the quality, 'di ba? And not the quantity alone. So it should be that the treatment plan to be used is not only cost effective but also clinically effective. Next is another goals and the benefits of EBT is the increased accountability. When we say increased accountability, many researchers have argued that there are certain therapists that are more effective for certain clients with a certain treatment plan. Thus, they are then held accountable for their effectiveness and the treatment plan used. So if this approach is adopted, it would likely to involve tracking the therapist's success rate, just as one would assess the effectiveness of a certain plan. So as EBT is used on interventions, of course, and it is proven effective, the clients using that intervention is held accountable for the success of that treatment plan. So, um, a lot now of rather, practitioner rather, is trying to integrate EBT with their intervention so that it would like have a credit on their name that the treatment plan that they use for some client is effective, and it will help them boost their career. But not just only that, the treatment plan as well will be used more often, and it is helpful to help more people cure whatever psychological disorder they are experiencing. Now, as I've mentioned, there are lots of interventions nowadays that is used in evidence-based therapy, because again, it is proven effective because of the various meta-analysis by researchers and proponents. First on the list is the acceptance and commitment therapy. Now, ACT, in a recent meta-analysis of 39 randomized trials, also known as the golden standards, it has found out that ACT is more effective than either placebo or the treatment as usual approach or the standard treatment for such issues. So furthermore, recent studies have shown that ACT is in the treatment of anxiety is ACT for another study is suggesting that ACT, or the acceptance and commitment therapy, is effective or is really effective in treating anxiety disorders, depression, addiction, and certain physical health issue. Next is the cognitive behavioral therapy. So, or the CBT, we all know, the most well-known and widely accepted form of treatment for many psychological issues. So, in the recent years, many researchers suggested, or even on the meta-analysis of some researchers found out that the CBT, there has been a solid evidence that CBT is indeed effective in treating anxiety. This is a study of Carpenter 2018. Depression, psychosis, body dysmorphic disorder. We also have this eating disorder. So these are and other psychological issues. So on our past discussions, we always mention CBT as the treatment for almost uh, disorders that we have discussed. The last is the dialectical behavior therapy, or the DBT. This is also an evidence-based treatment, as it has been shown to be effective or for relieving the symptoms and improving outcomes for patients with BPD, or the borderline personality disorder, and substance abuse, as well as patients with trichotillomania. So, furthermore, DBT may benefit more than just patients with BPD. There is also evidence that DBT may be an effective treatment for other psychological issues, including patients struggling with intellectual disabilities, but more research is needed to determine its effectiveness because DBT is not that used. So, more research is needed to determine the effectiveness of DBT in the mentioned disorders. Now, after discussing the value of evidence-based practice, we move on to the second ethical code. We have here the dual and multiple relationships in counseling practice. Now, to define dual relationship, as according to Zur 2014, refers to situations where two or more connection exists between a therapist and a client. Example of dual relationships are when a client is also a student, a friend, employee, or business associate of a therapist. Dual relationship usually involves boundary crossing, or an unacceptable, perhaps inevitable, or unavoidable dual relationships, and or boundary violations. It occurs when therapists cross the line of decency and violate or exploit their clients. So, so when we say boundary crossing, it's of course inevitable and avoidable because we really it, sometimes it's unavoidable to have um okay, now we will discuss the type of dual relationships. First is the foreseeable dual roles, are those that a therapist has time to consider or contemplate before engaging in them. For example, whether or not to provide psychotherapy to someone with whom you have had a prior social or business relationship. Second is the unforeseeable dual roles, is a role that cannot be reasonably foreseen. For example, uh, you wanted to join in a gym and you join a gym, and then you find out that one of your fitness instructor is a client of yours. So unforeseen. Next is sexual dual relationship. In this case, the client and the practitioner are involved in a sexual relationship. So, sexual dual relationships with current clients are always unethical and often illegal. So, illegal in a way that, for example, the client is married. So, technically, it's illegal. Next is the professional dual relationship. So this is where psychotherapists or counselors and clients are also professional colleagues in college, training institutions, and say presenters in a professional conferences. So you already have a professional relationship other than being a client and practitioner relationship. The last is the Social dual relationships is where the therapist and clients are also friends or have some other type of social relationship. For example, they are friends in social medias like the Facebook, the Twitter, there. So next we will discuss contexts where dual relationships can be avoidable. In this context, usually these dual relationships takes place in large cities or metropolitan areas where there are many therapists because you have the chance to choose who therapist you would want to attend to you. Next is unavoidable. This happens in rural areas, sports psychologies, because usually there are only one therapist, especially in areas, and worse is there is none. So you have no choice, but you really have to attend to that therapist. Next is the common or normal. This uh, relationship happens in parts of universities and colleges, training institutions, because usually in universities there is only one mental health care provider, and if happens you are a student of that health care provider, so therefore you have a dual relationship. Next is mandated. So for mandated, so these dual relationships takes place primarily in the military, prisons, jails, some police department, because you are mandated to have, say, you are mandated to have relationship with the mental health care provider because you are mandated by the law. You are in prison. And then the unexpected ones, because this occurs when a therapist is not initially aware that the client they have been working is also their friend, a colleague, a co-worker, or even an ex-spouse of another client. So it is a unexpected dual relationship. And next is we move on to the multiple relationships. So as defined, multiple relationship occurs in any situations, sexual or non-sexual, where multiple roles exist between a therapist and a client. The therapist had a second, significantly different relationship with their client in addition to the traditional therapist-client relationship. So these are the situations in which the psychologist and clients have an interaction in another setting that is unplanned and very brief. So in the American Counseling Association Code of Ethics, the dual and multiple relationships have been replaced with the term non-professional interactions. So if you have the copy of the ACA Code of Ethics in the 8.5 section, it discusses the prohibition of non-professional interactions with regards to sexual and or romantic relationships, previous sexual and or romantic relationships, and sexual and or romantic relationships with former clients. So furthermore, in the ACA Code of Ethics, multiple relationships can occur between a professional and a client when there is a professional relationship between the both of them. And at the same time is in a relationship with a person closely associated with or related to the person with whom the psychologist has the professional a relationship. Two, at the same time is in another role with the same person. And the last is promises to enter into another relationship in the future with the person or a person closely associated with or related to the person. So focus on the as a difference of the Code of Ethics for the ACA and the APA. However, multiple relationships is really prohibited in both Code of Ethics. So, for additional information here, as I've mentioned, that the dual and multiple relationships can be sexual or non-sexual. So for non-sexual dual and multiple relationships, it does not necessarily unethical and illegal, and it does not necessarily lead to exploitation. Why the term not necessarily? Because there are chances that the non-sexual dual and multiple relationships can be unethical and illegal, and there are chances that the non-sexual dual and multiple relationships um leads to exploitation. But we do need to discuss it further. Next is the sexual dual and multiple relationships is and will always be unethical and sometimes illegal. As I mentioned, sometimes illegal because it can be that you as a practitioner had a sexual relationship with a client, but that client is married, so technically it's illegal. Last thing is, dual relationships can be concurrent, meaning the therapy and the relationship takes place at the same time. So you're having a therapy while also you are both in a relationship, either sexual or non-sexual again, or sequential. Relationship takes place after the therapy has ended. However, as I've mentioned, as I've remembered correctly, and correct me if I'm wrong, um, at least 2 years of it should be after 2 years of treatment psychotherapy relationship, you can have a relationship with your client if I'm not mistaken. Now, why are multiple roles should be avoided? The shorter version for this, or the very simplest explanation for this, is the purpose of avoiding multiple roles is to avoid conflicts of interest in our work or in the work of psychotherapists, and to avoid exploiting or otherwise taking advantage of the power the psychologists or the counselors may have been over the people with whom they work with. So it is very clear there. To take note, to maintain ethical standards, I have here listed some of the strategies to maintain the ethical standards. First is the respecting human rights and dignity. So this is the basic and the most important strategy out of all. You can never be wrong in respecting one's dignity and human rights in whatever context, in whatever social status, in whatever situation. Next is to enhancing the quality of professional knowledge and its application. The goal of the therapist is to help the client alleviate the stress and whatever current situation he or she is. Thus, the professional knowledge and its application is much needed. Over the years of practice, the quality of professional knowledge is enhanced through repetitive exposure and experience. Next is ensuring the integrity of practitioner-client relationship. The integrity of the practitioner is at stake for whatever may happen to the client during the treatment. Not only that, mental health care providers should ensure the practitioner-client relationship during the treatment process. There should be no other relationship between the client and the therapist. Not only it ensures the integrity of the practitioner, but also it would avoid biases and for further fallacies in the coming session. Next is protecting the safety of the clients. The safety of the client during the session is held accountable to the practitioner. Whatever happens to the client during the treatment process, the therapist is responsible for it. Information should be kept confidential, not only because of the safety concerns, but because confidentiality is an ethical code to follow in any profession. Next is some of the ethical principles of counseling and psychotherapy. So these are based on the meta-analysis of our researchers. First is being trustworthy, or honoring the trust placed in the practitioner, also called as the fidelity. Practitioners who adopt this principle acts in accordance with the trust placed in them, strive to ensure that clients' expectations are ones that have reasonable prospects of being met, honor their agreements and promises, regard confidentiality as an obligation arising from the client's trust, and restrict any disclosure of confidential information. Next is autonomy, or the respect for the client's right for self-governing. Practitioners who respect their client's autonomy ensure accuracy in any advertising, emphasize the value of voluntary participation in the service being offered, and inform the client in advance of foreseeable conflicts of interest or as soon as possible after such conflicts become apparent. Next is beneficence. The principle of beneficence means acting in the best interest of the client based on the professional assessment. It directs attention to working strictly within one's limit of competence and providing services on the basis of adequate training or experience. Next is non-maleficence, or a commitment to avoiding harm to the client. So non-maleficence involves avoiding sexual, financial, emotional, or any other form of client exploitation, avoiding incompetence or malpractice, not providing services when unfit to do so due to illness, personal circumstances, or intoxication. The last is the justice, or the fair and impartial treatment of all clients and provisions of adequate service. The principle of justice requires being just fair to all clients and respecting their human rights and dignity. A commitment to fairness requires the ability to appreciate differences between people and to be committed to be equal to equality of opportunity and avoiding discrimination against people or groups contrary to their legitimate personal or social characteristics. Now, this is the last slides of all. So, clients also look for the personal moral qualities of the therapist that they will hire. So some of these personal moral qualities are empathy, the ability to communicate, understanding of another's person, of course, highly needed. The competence, a personal commitment to consistency between what is professed and what is done. Next is wisdom, the possession of sound judgment that informs practice. Sincerity, a personal commitment to consistency between what is professed and what is done. Next is courage, the capacity to act in spite of known fears, risks, and uncertainty. Oh, shoot, sorry. I forgot. Next is humility, or the ability to assess accurately and acknowledge one's own strength and weaknesses. Next is respect, highly needed also, showing appropriate esteem to others and their understanding of themselves. Next is resilience, the capacity to work with the client's concerns about without being personally diminished. And last is the integrity, commitment to being moral in dealings with others, personal straightforwardness, honesty, and coherence. And these are my references. Now, thank you for listening. If you have questions, suggestions, corrections on my reporting, you can PM me or ask me in the comment in the chat box if you have any, and I'll try my best to answer those. Thank you very much and have a good day.